Hi everyone, I am Shahan. Welcome back to my channel Dr. Shahan's class, and here in this video I will discuss about a very important topic, that is Cushing syndrome. So if you are new to my channel, please subscribe this channel because this channel contains so many videos on disease. This is the only channel on disease. I have created this channel with so many videos on diseases. So if you are a medical student, if you are interested in disease, please subscribe this channel. It will surely add knowledge to you. So without further ado, let's get on to it. Now let us start. Cushing syndrome. You can see Cushing syndrome. And this is the example, this picture of a Cushing syndrome. Now why Cushing syndrome is caused? It is caused due to cortisol increase. Cortisol. There is a hormone inside your body known as cortisol. When it increases, it has different cause like why it increases, but you just remember when cortisol increases, it actually produces Cushing syndrome. Cortisol is a hormone which is responsible for stress, okay? Sometimes stress and other functions it has, but remember cortisol when increases, it can produce Cushing syndrome. So what are the things cortisol actually produce when it increases in our body? Number one, you can see the picture now, fat pad, buffalo hump. You can see buffalo hump. What is buffalo hump? You know buffalo has a hump on its back. So these patients also has a buffalo hump. That is a fat pad, a pad which is made of fat, and that is there inside this patient. Another very important thing of this patient is the patient have stretch mark. The patient has stretch mark in the belly. So you can check the belly of this patient. You can see the picture, stretch marks. And these marks are because the patient becomes obese. As the patient becomes obese, stretch marks develop. Next, another thing, if you look at the limbs, if you look at the hands, if you look at the legs, you can find out thin arms and legs. The arms are very thin and the legs are also very thin. And you can also understand there is bruising. There is the skin bruising, and the skin becomes thin, and as the skin becomes very much thin, it easily bruises. So there will be always bruising on the skin. And if you look at the face of this patient have a peculiar face. That is, this patient has moon face. What is moon face? Moon face means round face, just like a full moon. Full moon is round shape. In the same way, these patients have round shape, moon-like face. And if you check the cheeks of this patient, you can find out red cheeks. And the thinning of hair, you can also find out the hair is thin. Thinning of hair. The hair is becoming thin day by day. And you can also find out extra face and body hair. Sometimes you can find out body hairs and facial hairs. So all these things you can actually find out. So let's revise once again. Fat pad, that is the buffalo hump I told you. Next is the thin arm and the legs. The arms become very much thin. Number 3 is the bruising of the skin, and also number 4 is the round face, moon shaped face. Okay, round moon shaped face. You can see this picture also. You can see stretch mark, the belly. You can look at the belly, there will be stretch mark. Always remember why this stretch mark develop, because there is overweight. Abdominal weight gain, and basically this is abdominal weight gain. That is why it is known as abdominal weight gain, because abdomen you can find out the fat, the obesity develops. So you can find out stretch marks in the abdomen, and easy bruising. Easily the skin becomes thin and the skin becomes bruised. The bluish coloration you can see, that is known as bruising, and that is easily it can be found in this patient. And if you check the hands of this patient, the limbs of this patient, you can find out the hands and the limbs are very, very thin. You can find out the hands and the limbs are very, very thin. And always remember the hump. The hump is very important. The hump is in the back. So if you check the hump, you can find out that is known as the fat pad, that is known as the buffalo hump, the same thing. Fat pad, buffalo hump, the same thing in the back, always remember. And if you check the face, always remember moon-shaped face. What is the face? Moon-shaped face. And hirsutism. Hirsutism means the sometimes you can find out the hairs on the face, that is hirsutism. Now this slide actually showing you actually why the cortisol increase. I told you the cortisol can increase. Now cortisol increases in Cushing syndrome due to different factors. It can be due to different factors. So if you are a patient of asthma and you are taking glucocorticoid medication, it can also increase your cortisol level, and that can also produce Cushing syndrome. But there can be another cause of Cushing syndrome, like a small tumor in the pituitary gland or a small tumor in the adrenal gland can actually produce this Cushing syndrome. You can see how these all are related, from hypothalamus, pituitary, from pituitary to the adrenal glands. So there is a signal pathway. You can see the signal pathway. The right side, hypothalamus, it signals to the pituitary gland signals to the adrenal glands, and then actually it produces a lot of cortisol from the adrenal gland. So now let's come into the definition. I don't teach you definition at first, because if I teach you definition you will run away at first because it's so boring. Don't worry, I am making it very easy. What is Cushing syndrome? Cushing syndrome is also known as hypercortisolism. What is the meaning of hypercortisolism? Break the word. Hyper. Hyper means increase. Cortisolism means cortisol increase. Cortisol increase. Cushing syndrome. C for cortisol, C for Cushing syndrome. C for cortisol, C for Cushing syndrome. Remember, C for cortisol, C for Cushing syndrome. C for cortisol, C for Cushing syndrome. So cortisol increase in Cushing syndrome is caused by unusually high level of hormone cortisol in your body. Unusual increase of this hormone known as cortisol in your body, when it is increased, then it causes Cushing syndrome. Cortisol is a steroid hormone. Remember, cortisol is a steroid hormone. And what is the function of cortisol? What does cortisol helps in? Cortisol helps in maintaining different body response, including stress. We know stress, it increases stress also. During the time of stress, we can find out cortisol release. If you have too much cortisol, it can cause you weight gain. I told you it can cause you obesity, and specifically abdominal weight gain. Remember, abdominal weight gain, and that actually produce the stretch mark. And also not only stretch mark, but also it produce the easy breathing. It produce easy breathing and produce the thin limbs, hypertension. It can also produce high blood pressure and also diabetes. Remember, it can produce diabetes. All these things actually it can produce. Now why this cortisol has been increased in your body? I told you it can be of several causes. One of the most important and most common cause is taking of a medicine known as glucocorticoid. Now glucocorticoid, where does this glucocorticoid used? Glucocorticoid is used in treating asthma. Other cause can be small tumor in pituitary and adrenal. Now look at this picture. This is a real patient. You can see the real patient, and this patient is having what? You can see left side picture, A. Left side is the A. The girl is shown. The girl is having moon-shaped face. Remember the moon-shaped face. And can you see the hairs of this girl? Yes, on the left side picture, face. Look at the face. So moon-shaped face, and the hairs is thinning. Hair is thinning. Now we come to the right side. Above picture, you can see the stretch mark, abdominal stretch mark. You can see how it develops. Abdominal stretch mark. Why? Because the abdominal obesity. I told you, abdominal weight gain. And if you come to the C, the below picture, you can see the fat pad. You can see the small star in the back. That is actually locating the fat pad. I already told you, fat pad, that is known as the buffalo hump. Buffalo hump. So all these are actually clinical feature. This shows that this patient is having increased level of cortisol in her body. Okay, increased level of cortisol in her body, and that is nothing but Cushing syndrome. That is nothing but Cushing syndrome. Look at this picture. This is another picture, another patient. You can see the left side picture, moon face. How is the face? Moon face. Okay, round moon face, full moon face, you can see. And you can see the hair is becoming thin. So next you come to the middle picture. The middle picture, what can you see? Yes, if you check the back, you can see the hump. You can see the back. You can see the buffalo hump. Buffalo hump. Okay, fat pad B. And if you come to the C, the right side picture, you can see the stretch mark. Yes, you can see the stretch mark, abdominal stretch mark, because of the obesity developed in these patients of Cushing syndrome. See this picture. This picture has been taken from the past year question, PYQ, and from the medical PG examinations. So you can see this picture. This picture is representing what? Yes, it is representing the abdominal stretch mark, abdominal stretch mark. And this actually represents which disease? That was the question. This actually represents Cushing syndrome, Cushing syndrome. So always remember that Cushing syndrome has this kind of marks in the abdomen. Thank you so much for watching this video. If you like this video, make a thumbs up, because our channel is the only channel particularly on different disease we have made videos. So if you are interested in knowing different diseases, please subscribe. That will surely help you. You may be a physiotherapy student, you may be a BSc nursing student, you may be a pharmacy student, you may be a pre-med student, you may be anyone who is related with the healthcare system. Please subscribe this channel, because this channel will increase your knowledge in different clinical diseases, and surely you will learn a lot. If you want to know more, please go to the playlist section of this channel, and you can find out different playlists like know about diseases, medicine, pathology. Watch all these videos series one by one. You will have a great knowledge from this channel, I can promise you. Thank you so much for watching this channel, and please subscribe. Thank you. Have a nice day.